Good afternoon, everyone. My name is Rich Riley. I'm a member of University Hospital's Marketing and Communications team, and I'll be the moderator for our event today. On behalf of the entire University Hospitals family, thank you for joining us for our webinar on low back pain, its causes, surgical and non-surgical treatment options. 85 to 90% of people in the United States experience back pain. Whether you experience back pain along your spine or concentrate it on your lower back, it can make it difficult for you to perform everyday tasks or limit your ability to work or enjoy life. While some back pain is acute and lasts about 6 weeks, other cases of back pain are chronic and persist for more than 3 months. It is time to realize your potential and start living to walk into a new beginning of long-term relief, mobility, and renewed quality of life. Our presenter today will help you understand your low back pain, its causes, and how to treat it. Now, a few housekeeping notes before we begin. In this platform, all attendees are muted. While you won't be able to ask questions through your microphone, please note the Q&A function at the bottom of your screen. If you have a question that is not addressed in the presentation, please submit your question through the Q&A feature, and our presenter will address questions at the end of her presentation. Also, this afternoon's webinar is being recorded and will be available for viewing on demand in the near future. It will also be posted on the University Hospital's website, and as an attendee of today's session, you'll receive an email with a link to that site. It is my pleasure to introduce our speaker for today. Dr. Christina Chang is an orthopedic surgeon at University Hospital's Cleveland Medical Center and University Hospital's St. John Medical Center. She also sees patients at UH Westlake Health Center, UH University Suburban Health Center, and UH North Ridgeville Health Center. She is an assistant professor of orthopedics at Case Western Reserve University School of Medicine. Dr. Chang joined the UH Cleveland Medical Center medical staff in 2018. Dr. Chang specializes in treatment of spinal disorders of the cervical, thoracic, and lumbar spine. She has a special interest in degenerative spine conditions, spinal trauma, spinal deformity, disc herniation, and metastatic spine disease. Dr. Chang earned her bachelor's degree in biology, graduating cum laude with distinction in research from Cornell University in Ithaca, New York. She earned her medical degree from the University of Buffalo School of Medicine in Biomedical Sciences in Buffalo, New York. She completed her internship and residency in orthopedic surgery at UH Cleveland Medical Center and a fellowship in orthopedic spine surgery at Harborview Medical Center, University of Washington, Seattle. As a physician, Dr. Chang strives to ensure that her patients and their families have an adequate understanding of their spinal issues, expected outcome, and prognosis. She is a strong believer of using a multidisciplinary approach in managing spinal disorders and employs all possible non-surgical treatment options prior to offering surgical treatment when possible. She is a member of the American Academy of Orthopedic Surgeons, AO Spine, North American Spine Society, and the American Orthopedic Association. Ladies and gentlemen, Dr. Christina Chang.
Good afternoon, everyone. Can you all hear me? I want to thank Rich for that warm welcome, and I want to thank everyone for joining us this afternoon and taking the time to participate in our event. Like Rich said, my name is Christina Chang. I'm an orthopedic spine surgeon, and today we'll be talking about low back pain. And I'm sure that everyone here will or has had experienced some form of low back pain at least once in their lifetime. And so low back pain is a common condition that we commonly see in our clinics. So about 85% of patients will experience low back pain at some point in their life. It doesn't matter whether you're a female or male, it kind of occurs equally for both genders. Individuals between 35 and 50 years old are more commonly affected, but does not mean that patients younger than 35 or older than 30 or 50 don't have back pain. So 90% of back pain usually resolves within 4 to 6 weeks. So low back pain can be divided into different categories. Acute low back pain are usually the most common. It lasts usually less than 6 weeks and usually goes away on its own, usually with rest, with activity modification. People feel better within 6 weeks. With subacute low back pain, these are usually pain that lasts for about 6 to 12 weeks and then can sometimes resolve on its own or with additional help. Chronic low back pain, and these are the ones that usually last more than 12 weeks or longer. And sometimes patient may initially present with acute low back pain and ultimately develop chronic low back pain over time. And patients with chronic low back pain may sometimes have good days and bad days, and the pain may not always be constantly there depending on their activities. So in terms of the natural history of low back pain, 70% of patients usually have some improvement within 2 weeks, and about 90% improves within 6 weeks. And then there's a small percentage of patients, about 3%, who may not show any improvement within 6 to 12 weeks. And to better understand low back pain, I think it's helpful to understand the anatomy of the spine. So today we're focusing more on the lower back, and that's mainly the lumbar spine. So the spine is divided into the neck, which is the cervical spine, the mid-back, which we call the thoracic spine, and the lumbar spine, which is the lower back. The lower back consists of 5 vertebrae, or the bony part of the spine, and between the bones are these intervertebral discs, and these are kind of cushions or shock absorbers for the spine. And generally, the normal alignment of the lumbar spine, there is this normal curvature which we call lordosis. And this is normal, and this gives us, allow us to kind of stand in the upright posture and allow us to withstand all the forces from our daily activities. The lumbar spine is pretty mobile. It allows us to do bending forward and bending backwards. The back of the spine, we have these joints called facet joints, and they are the joints that connect the upper vertebrae with the lower vertebrae. And this also allows motion with forward bending and backward bending, along with the disc. And similar to hip joints and knee joints where you can get arthritis, you can also get arthritis within these facet joints and disc space over time with increased activity and wear and tear. Surrounding the lumbar spine are muscles that help further support the spine. So looking from the back, we all have muscles that extend from the base of the skull and extend all the way down to the pelvis. And there's multiple layers of muscles, as you can see in this diagram here. And all these muscles help us all stand upright and extend our spine and provide support for our lumbar vertebrae. Additionally, we all have abdominal muscles, whether we think we have it or not, but we all have it. And that helps provide support from the front of the spine and helps offload some of the stress that we see with everyday activities onto our spine. Additionally, we all have hamstrings behind our thighs. That's the muscle that run along the back of your thigh, as well as gluteus muscles around your buttock region that also helps support our spine and allow us to stand and walk upright. Any weakness or tightness in any of these muscles can cause low back pain issues. So what are the causes of low back pain? So there are multiple causes of low back pain. There's usually, it's not always one thing that causes back pain. So injuries are a common cause. So muscle strain and spasms of the muscles that run along the back of your spine, or abdominal weaknesses can all cause back pain. And this is usually due to a twisting or pulling mechanism on the muscle or ligaments that surrounds the spine that can cause pain. This can be due to improper lifting or overstressing of the back muscles from excessive repetitive bending or lifting of heavy objects can cause muscle strains and back pain. Poor posture as well as weak muscles can put you at risk of developing these muscle strains and developing pain. Other injuries can also be fractures involving your lower back vertebrae, and this can range from high energy fractures from car accidents, or if you fall from a high location, such as off a tree or off a ladder. And sometimes these are emergency that requires surgery. However, those are usually not the patients that show up and walk into my clinic. The common fractures that I see that walk into my clinic are patients who have compression fractures, similar to what is shown in this X-ray right here. Just like the name suggests, compression fracture is due to compression of the lumbar vertebrae. So here an example of a regular normal vertebrae. It's a nice square box. And you can see that in this one, the box has been squished. And you can see there's a fracture right there involving the vertebrae. These are commonly seen in patients who may be a little bit older, who may have a history of osteoporosis or has osteoporosis and just don't know about it. And what happens is they may have a simple fall from standing or walking that normally would not cause a fracture, but because their bone is a little bit weaker, they're more susceptible to these fractures. And then these can cause back pain. Although luckily, usually these type of fractures do not require any surgical intervention, and usually they will heal and get better on their own. Another cause for back pain are degenerative changes. Like I mentioned earlier, similar to your hips and knees, you can get arthritis in your joints. You can also get arthritis in your back because like your other joints, the spine also has its own joints that can develop arthritic changes. One example would be degenerative disc disease. So like we mentioned earlier, within our spine, we have these discs that sits between the bone. They act as shock absorbers, and with every wear and tear and age, they can start to wear out and get narrower, similar to what's shown in this picture down here. And over time, that can cause back pain. Additionally, we talked about earlier the facet joints. So those are the joints, like I said, connecting one vertebrae to another vertebrae that allows motion through the spine when we bend forward or bend backwards. And over time, those joints can also develop arthritis. Similar to hips and knees, these joints are also surrounded by cartilage, and that cartilage can start to wear out and thin out, resulting in arthritis and causing back pain. And as the arthritis advances, when you start to develop wear and tear of the disc, as well as arthritis of the joint, there seems to develop increased mobility in that segment sometimes. And when that happens, you can develop something called spondylolisthesis. And that means that there is a forward slipping of the vertebrae. So for instance, in this X-ray right here, you can see the vertebrae lining up. And if you draw a line following the back of the bone of the vertebrae, they should line up. And you can see here, when we reach to this level, you can see distinctly that this vertebrae sits a little bit more forward compared to the pelvis, or we call it the sacrum right here. And that's indicative of spondylolisthesis. And not everyone who has this have back pain. Some people can walk around with this and not have any pain at all, while other people can be in excruciating pain. And with arthritis, it can also occur not just at one level, but it can occur at multiple levels. So when you start to have arthritis at multiple levels, that can cause different segments to move, and over time, you can develop something called degenerative scoliosis. So that's due to curvature of the spine, as you can see in this X-ray right here. Sometimes there are patients who may have had scoliosis as a teenager, and they can develop arthritis from that scoliosis as well. And sometimes back pain may not just be pain along the lower back, but sometimes patients may have pain that also radiates down their leg. Usually, patients will come in and tell me they have pain that kind of radiates around their buttock regions, travels down the front or back of their thigh, and sometimes it may even travel down their leg, into their ankle, into their foot. And people sometimes call this the sciatic pain. And usually this is due to a nerve impingement. And what happens is this is an MRI of a spine, and an MRI allows us to see all the nerves. And sometimes you can see the nerve exiting out, and in this case, there's evidence of a disc herniation right here, which can cause pinching of the nerve as it exits the spine to go down your leg. And depending on which nerve it pinch, it can follow a certain path down your leg. And that's the pain that patients commonly describe as sciatic pain. Other type of leg pain that patients may have can be from spinal stenosis. Spinal stenosis is due to narrowing of the canal where your nerves are running. So in this picture right here, this is a cross-section of the spine. Here is the front of the spine. Here is the back of the spine. Here is the canal in the middle where all your nerves are running. And at each level, you have nerve that exits through the sides that goes down the right and left leg. However, if you have stenosis in the center here where your nerves are, you can develop something called neurogenic claudication. How stenosis forms here is usually due to degenerative changes. You can have broad disc bulges, you can have bone spurs that may encroach into that central canal, causing compression of the nerves. And when patients present with neurogenic claudication, usually they tell me the classic findings are they complain of leg pain, usually both legs, that kind of diffuse leg pain, heaviness sensation, worse when they're standing upright, or if they're walking, they can only walk a block or two before they have to sit down. They usually feel better when they sit down or they lean forward, because when you sit down and when you lean forward, you're flexing the spine. And when you flex the spine, it opens up the canal and takes the pressure off the nerves, which help relieve the leg pain. And so the classic story is someone would tell me that, when they go grocery shopping, they tend to like to lean on the grocery cart because it lets them walk a little further and helps with their leg pain. And we call that the positive shopping cart sign. So when I see a patient in clinic who complains of back pain, first thing I want to make sure is I want to make sure there's nothing bad going on. We call these the red flags, things that are a little bit more serious, that may need a little bit more attention, and sometimes even emergency surgeries. So usually I run through several questions just to make sure that patients don't fall into any of these categories. And some of these conditions include cauda equina syndrome. What that is when you have significant stenosis around your nerves, where there's so much compression around your nerves that is causing you to have bowel and bladder incontinence. And I'm not just talking about, stress incontinence or urge incontinence, like sometimes, older patients may experience. This type of incontinence is where you can be sitting there watching TV, not having any sensation of needing to go to the bathroom, and all of a sudden you kind of release yourself and not even be aware of it. Patients may also, what I also look for is something called saddle anesthesia. And what that is this numbness sensation in your private areas. So, I would ask you, when you go to the bathroom and you clean yourself, do you feel yourself cleaning yourself? If you don't, that's concerning. And severe leg weakness or numbness, all those three symptoms combined makes me think that you may have cauda equina syndrome, which is something that's a surgical emergency that needs to be dealt with immediately. Another condition that's a red flag would be spinal infections. You can get infections involving the vertebrae of your bones. You can get infection involving the disc. Usually spinal infections can happen if you had an infection somewhere else in your body that wasn't appropriately treated, and the bacteria travels through the blood and enters your spine and sits right there and starts to grow in that area, causing infection and back pain. Sometimes you can get epidural abscesses. What's that mean is that you can get an abscess that forms within the canal where your nerves are sitting. And that can cause nerve compression and can cause leg pain and weakness as well. Usually, people who are at high risk of spine infections are people who have history of IV drug use, people who had maybe a recent infection that was not appropriately treated, or someone who may be immunocompromised. For instance, patients who are on chemotherapy medications that are necessary to suppress their immune system, or patients who may be diabetic or who may have rheumatoid arthritis and are on chronic steroid treatments, which are medications that can sometimes suppress your immune system. Another condition would be tumor or cancer around the spine. And the most common form that we see in spine are metastatic cancer. So usually cancer that originate somewhere else in the body that traveled and seated itself in the spine. So I would typically, look for any history of cancer, look for any history of unintentional weight loss, night pain, fever, chills, or anything that would make me think, is this cancer? And oftentimes, back pain can be related to something that may not be even related to your back. Other conditions can also present as back pain. Urinary tract infections or kidneys can present with back pain as well. The kidneys do sit a little bit more towards the back of your body. Fibromyalgia, which is a common condition due to diffuse muscle pain in multiple joints, can also present with back pain. Pancreatitis is inflammation of your pancreas, can also present as back pain. Similarly to your kidneys, they do sit a little bit towards the back of your body, and that's why patients can present with not only abdominal pain, but as well as back pain. Abdominal aortic aneurysm can also present as the sharp stabbing pain in the back. That's also because your aorta, which is the large artery that runs along the front of your spine, can have refer pain to the back. And certain gynecologic conditions such as endometriosis or ectopic pregnancy can also sometimes present with back pain. So what are the risk factors? Who are at higher risk of developing back pain? So there are multiple factors. One is age. Unfortunately, as we get older, things starts to wear, our joints starts to develop arthritis, our back starts to develop arthritis, and that can cause back pain. Sedentary lifestyle. So if you don't normally exercise or stretch, unfortunately that can cause low back pain because your muscles can start to become weak and no longer support your back as well, and that can cause back pain. Being overweight is also a risk factor for low back pain because as you put on more weight, that's more stress on your lower back, more stress on your vertebrae, on your disc and your joints, and ultimately causing acceleration of development of arthritis and back pain. Muscle weakness, as we've mentioned, commonly, women who were pregnant, who had a belly from their pregnancy, once they deliver, all that core muscle that they had are weak just because it was expanded to carry the pregnancy. So a lot of patients who had just had a baby, commonly see me for back pain. And patients who may have had abdominal hernia repairs where, they had surgery in their abdomen where muscles were cut, and, if the muscles don't heal appropriately or if they don't regain their strength, then that can cause weakness in your core muscle and causing back pain. Another factor that sometimes people don't think about is your mattress. What do you sleep on? Do you spend all your time sleeping on a recliner, which is not usually the best way to sleep? If you have a mattress that looks like this, where it's more than 10 or 20 years old, then it's probably not giving you the support that you need anymore for your back, and that can cause back pain issues. And smoking, studies have shown to cause back pain. And people who smoke tend to have more back pain than people who don't. The reason behind this is because the chemicals, the nicotine and tobacco within the cigarettes can cause constriction of the arteries or the vessels that supply blood and nutrients to your bone and your disc and your joints. And if you cut off that nutrient supply or the blood supply, then your joint starts to develop arthritis quicker and they wear out quicker, which can cause back pain. And occupational hazards is another cause. Both a strenuous job can cause back pain as well as a sedentary job. Strenuous job, as you can imagine, involving a lot of heavy lifting, twisting, turning, can put a lot of stress on your back, your muscles, and can cause back pain. And sedentary jobs can cause back pain also because, you know, you're constantly sitting in one position, doing a desk job, looking at the computer. You're not moving as much, so your muscles can start to get weak or tight. You know, you're sitting in one position, your hamstrings can get tight, your gluteus muscles get tight, and then that can all come together and cause back pain. Mental health is also something that can be associated with back pain. Patients who have anxiety conditions or depression or just a lot of stress in their lives can have back pain or develop back pain from that. And so, you know, getting these things under control can be helpful. I mean, some of these things are things that you can't really change. For instance, your age, you can't change that. But, you know, controlling your diet, you know, exercising, changing your mattress, quitting smoking, these are things that you can potentially change to lower your risk of developing back pain. So imaging, you know, do everyone need imaging who have back pain? And usually the answer is no, not everyone needs to have an x-ray if they come in for back pain. Usually if your pain was just a week or 2 weeks, you know, I would hold off on any x-ray because, you know, 90% of these patients do get better and we don't need to expose you to radiation if we don't have to. Patients where I would get an x-ray are patients who I feel are at risk of maybe having a fracture, maybe they had a traumatic injury, patients who may have a history of osteoporosis or who may be at risk of osteoporosis but just don't know they have it. I would get an x-ray just to make sure they don't have compression fractures. And patients who, you know, continue to have pain even after 4 to 6 weeks with no relief, then I get an x-ray just to see what else may be going on. Other imaging that we can get are CT scans, and these are like x-rays, but higher amount of radiation exposure. It does give you a better picture of the bones as demonstrated here. You can get serial cuts of bones at different sections as well as cross sections of the spine, which will allow you to evaluate the bony anatomy, the facet joints, and so that may be helpful as well. These are commonly, they may commonly get these in the emergency room if you were involved in a, you know, high-speed accident or trauma. It gives them a better picture of any potential fractures. And MRI is also a imaging modality that sometimes we may use. MRI, unlike X-rays or CT scan, does not use radiation. It's based on magnets. And MRIs give us a clear picture of soft tissues like the disc, the nerves, the muscles. And it gives us an idea of, you know, degenerative disc or any area of stenosis or pinched nerve. Similar to what you see here, you can get a side view of your bones. These are the discs between the bones vertebrae. Here's your spinal cord, and, you know, there's your nerves coming down, and you can see there's a lot of good space around the nerves with no evidence of impingement. And similarly, on this cross-section view, you get a good view of the canal where the nerves are running. Those people who can't get an MRI because either they have stents or a pacemaker that's not compatible with an MRI, there's also an option of getting a CT myelogram in order to better visualize your nerves. This is a little bit more invasive than an MRI. It involves injecting contrast within the canal here and then running a CT scan. And by looking at the amount of contrast that goes through and passes through can tell you if there's stenosis in that region. Unfortunately, the problem with MRI is because you can see so many structures, give you such a detailed picture that commonly, if you MRI everyone who's greater than 60 years old, majority of the patient will have something abnormal. However, only, not everyone who has something abnormal on their MRI have symptoms or is symptomatic, and 1/3 of asymptomatic patients will have something abnormal in their MRI. And does not mean that we need to do anything about it. And even if you look at patients who are less than 60 years old, about 20% of them will show a lumbar disc herniation. However, they may be pain-free, they may not be asymptomatic. So you have to be careful when you read your report from the MRIs that, just because you have these findings, doesn't mean that, it may not be the cause of your pain and it may not need correction of all those problems. So how do we treat low back pain? So I generally like to go from least invasive to invasive. So to start, if you're presenting with, 1 or 2 weeks of back pain, I would recommend starting with some anti-inflammatory medications such as ibuprofen, Motrin, Aleve, or Tylenol. If you're having spasms in your back, muscle relaxants can help with that. If you're having back pain with sciatic pain, where you feel the pain radiating down your legs, I may start you on a pack of oral steroids to help decrease the inflammation around those nerves. Heating packs and cold packs are also helpful in reducing some of the muscle spasms, some of the inflammation in your lower back. Over-the-counter creams and patches, such as lidocaine patches or Salonpas Passage, or icy hot creams or Bengay, can also provide some relief with acute back pain. And most importantly, I always recommend that you continue moving. I don't want you to lie or sit in one position for long periods of time, because that makes it worse. If you sit for long periods of time or stay in bed for long periods of time, it makes your muscle tighter. And so when you go and get up and move, that causes more pain. So by moving, either simple things, just walking around the house, can help release some of that tension in the muscle. And definitely stretching and exercising if possible to help loosen up the muscles and giving it more flexibility. If all those fail and you're still having issues, then the next step I recommend is your referral to physical therapy. These are trained professionals who have been trained to help you with stretching and strengthening of your muscles and your joints. Working with them, patients do see good relief, especially with acute and chronic back pains. Other options include massage therapy, acupuncture, as well as chiropractic care can also help with back pain. And here at UH, we have multiple facilities throughout Cleveland where you can work with a physical therapist to help you. And additionally, at UH, we have the Connors Integrative Health Network, which is a group of board-certified expertise in area of acupuncture, chiropractic therapy, massage therapy, stress management training, who can also help you with your back pain conditions and issues. So I find this to be also beneficial as well. And in some, cases, patients may have tried all that, but still have this continued pain. And that's when we may start to get into more invasive management and treatments. Usually at this point, if you're still not having any relief, then I would get an MRI to see a better idea of what may be going on. It may be degenerative disc, it may be a nerve compression, it could be lumbar stenosis, and that's when an MRI would be helpful. So if you are having more of a muscle kind of pain, then we can refer you to pain management or PM&R, also known as physical medicine and rehabilitation. And these are doctors that are trained to do certain injections and treatments of musculoskeletal pain. Trigger point injections can sometimes be helpful for more of that muscle myofascial pain. Occasionally, they may offer you radiofrequency nerve ablation or epidural steroid injections if they feel that this pain may be due to a pinched nerve or originating from inflamed nerves. So those can help with some of that nerve pain, that sciatic pain, that leg pain that radiates down your leg. And then if all things fail, the final step would be surgery. And that depends on what is actually causing your pain. If your pain is due to a pinched nerve or lumbar stenosis, generally surgery can be helpful in helping alleviate that pain. If it's just back pain due to muscle issues or weakness, surgery is not the best option for that. Times when back pain may be a surgical option is if your back pain is due to degenerative deformity, such as the lady with the curvature of the spine. That can affect your overall alignment and can cause low back pain. And sometimes correcting that alignment can help alleviate your back pain. However, surgery is not always a guarantee of getting rid of all your back pain. So how do we prevent back pain? And so we kind of have to go back to that list of risk factors that may be associated with putting you at a higher risk of back pain. And like we mentioned earlier, there are certain things that you can change. Unfortunately, age is not something we can change. So I think exercising regularly is important, getting yourself into a exercise regimen. It doesn't have to be strenuous. You don't have to run marathons, but light aerobic activities I think are helpful. Stretching is important, stretching your hamstrings, your back and your core muscles, keeping them flexible, and that can help alleviate and prevent back pain. Commonly, I do see a lot of patients who have back pain because their hamstrings are so tight. And definitely I would refer those people to physical therapy to work on stretching and loosening up their muscles. Core and back strengthening are important, especially, some women who has had a baby and, in the postpartum period, they're having a lot of back pain. And that's maybe because their abdominal muscles are weak from being so stretched. People who do a lot of heavy lifting, need to really work on their core and their back muscle to help strengthen up their back and support them while they do their heavy lifting activities. Another important factor is maintaining a healthy weight and diet. So, like we mentioned earlier, overweight patients have higher risk of low back pain due to the amount of weight and force that your lower back has to see with everyday activities. And with increased weight and force, that can cause wearing of the disc and accelerating the progression of arthritis. Another thing is making sure you take your calcium and vitamin D. This is important, especially in preventing osteoporosis and preventing fractures associated with osteoporosis. And it's important that you have both because calcium is what helps you build the bone and vitamin D is what helps your body absorb the calcium. So you kind of need both in order for this to work. we normally get vitamin D from the sun. And, living in Cleveland, Ohio, we don't always see the sun very often. And so we need to make sure that we supplement with vitamin D. And this is something that, you can talk to your primary care providers. They can check your vitamin D level and see where you at. And, a lot of people in Cleveland, we are vitamin D deficient because we don't see the sun often. And so this is something that's good to start early. In order to also prevent osteoporotic fractures and to, maintain good, healthy bone, are light aerobic exercises, which is something I also recommend for patients who may be at risk of osteoporosis. With light impact activity, such as light weightlifting, walking, running, or using the elliptical, you're putting impact on your bones. And this tells your body where to put more calcium and where to make the bone a little stronger. So those are important. It's also important to know that not only, there's usually a misconception that only women get osteoporosis. Unfortunately, men get it too. And the sad part is because no one usually pay attention to that, a lot of men go on undiagnosed with osteoporosis. Another factor to prevent low back pain are ergonomically designed furniture. So if you have a desk job where you're sitting down for long periods of time, you want to make sure you have a chair that provides good back support, good lumbar support. So, sometimes putting an extra pillow around your lower back can help accentuate that curve that we mentioned earlier, we call lordosis. And, you want to try to preserve that. And, if you're sitting in a chair that, is not going to preserve that, that can cause back pain. And definitely if you're spending long periods of time sitting, make sure to take the time to get up and stretch, especially during our current situation with the global pandemic. A lot of us have jobs where we're just sitting at home. So make sure you get up, move around, and stretch. Another prevention is lifting properly. So here's a picture. You want to make sure when you're lifting is you keep your back straight. You don't want to bend your back like this in order to lift your boxes. You want to make sure you lift with your legs and not with your back, because this type of posture will put a lot of strain on your lower back, causing back pain. And lastly, quitting smoking. As we mentioned earlier, smoking leads to further advancement of degenerative changes and arthritis and back pain. So in summary, like we mentioned earlier, low back pain is extremely common. Don't feel like you're the only one who has it. Everyone has it at least once in their lifetime. Fortunately, most resolve within 4 to 6 weeks with rest, with activity modifications. And back pain can be due to multiple causes, as we mentioned. And so that's something that you need to work with your primary care doctor, or maybe a spine surgeon or a pain management doctor, and try to figure out if we can try to help pinpoint the cause of your back pain. And most importantly, when I see a patient, I need to make sure I rule out all the red flags and make sure nothing bad or serious is going on. And if once we rule out the red flags, always start with conservative management first and work your way up from there. Thank you for your time and patience. And I do see patients on both the east side and west side. If you have any questions that you don't want to discuss here, I'll be happy to see you in clinic as well to discuss things further.
Okay, thank you so much, Dr. Chang. Just some really valuable information that probably means so much to so many people, seeing how many people do suffer from some level of back pain. We do have several questions, and we can start going through those now. First question is, I was diagnosed with mild scoliosis in my 20s. Will this contribute to low back pain later in life?
That's a good question. Like had mentioned, scoliosis can sometimes occur as a teenager and they may not need surgery, but over time, there's a chance that that scoliosis may progress as we get older due to arthritis changes. But, you just, as long as you maintain a good healthy diet, maintain good exercise regimen, and, doing all those preventions, I think it can prevent it from progressing and causing a problem later on.
Great, thank you. Next question. Is there a technical difference between a bulging disc and a herniated disc? And if so, does this difference really matter?
So a bulging disc, it's basically, I like to describe it as a s'mores. So when you have a s'mores, you have a graham cracker with the marshmallow in the middle, right? And so the graham crackers represent the vertebral bodies, and then the marshmallow is like the disc. So if you squish down on the marshmallow, on the graham crackers, the disc kind of bulges out a little, and that's what would be equivalent to a disc bulge. A disc herniation is when part of that gooey center of the marshmallow starts to squish out, and that's what we call a disc herniation. And like I mentioned earlier with MRIs, if you MRI everyone's going to have some form of disc herniation or disc bulge, but not everyone is symptomatic from it. And the time when it becomes a problem is if you are symptomatic, if you are having that sciatic pain and that radicular or leg pain, because the disc may be pinching on a nerve or something. And that's when we can potentially do something about. If you have it on MRI and it shows it on MRI, but you're not having any of those symptoms, then I wouldn't worry about it.
Thank you. Next question. I have tingling in my fingers, seems to be related to something pinched in my neck. Do you see patients for this?
Yes, so I see patients with neck problems, with lower back problem or mid back problems. Those are things that I do see. And similar to the lower back, where you get pinched nerve, you can get the same thing in the neck as well.
Great. Several questions regarding back exercises, weightlifting. This question asks, will a regimented back exercise program alleviate back pain after bending over from yard work, or pain and stiffness in the morning that subsides as the day goes on?
So yes, I think that a regular stretching or exercise regimen would be helpful in preventing that kind of back pain. Definitely, I recommend getting a regular stretch or regular exercise every day as part of your routine activities to help preventing back pain.
Great, thank you. Next question. The individual has a history and diagnosed S2 and L5 fractures, chemo-induced neuropathy sciatica. Their doctor tried trigger point injections, pain meds, caudal blocks, physical therapy. Aside from surgery, what else can be done?
So, the neuropathy itself is usually due to the chemotherapy. Unfortunately, chemotherapy is considered a toxin, but it's what can help you fight the cancer. And one of the side effects is neuropathy. And that's not something that surgery is going to fix in terms of the neuropathy from the chemotherapy, but usually there are certain medications, nerve medications that you can be started on to help with that neuropathic pain. Sometimes it may be gabapentin or Lyrica or something to help with that pain. In terms of the vertebral bodies, I think that, you've done a lot of stuff like the physical therapy, the injections. I think those are all options. It's hard to say if there's anything else without actually seeing your images or knowing exactly what is going on. But, if I would have to look at your images and see exactly what they mean in regards to your S2 and L5.
Thank you. Next question. I had an MRI a couple weeks ago. It showed disc 4 and 5 were degenerative. I'm being treated with spinal injections in the groin for pain and back. It's not helping much. What could be next?
So with degenerative disc disease, like you said, it can cause back pain. But also, I would like to know if you're having those leg symptoms as well. Sometimes with degenerative disc, with back pain, some patients will also develop leg symptoms. And if the injections aren't working for that, then there's surgical intervention where we can free up the nerves if there is stenosis that's contributing to this, that can help alleviate some of that pain. But if it's just isolated degenerative disc with just back pain, no leg symptoms or anything like that, surgery is usually not the best answer for that. And usually I would recommend, conservative options, working with physical therapy to maintain good core and core strength and back strength to support your lower back.
Okay, thank you. Next question. What treatment is available for compression fractures?
So compression fractures, the natural history of it is it gets better over time. But, some patients may have, different people have different tolerance of pain. Usually, I would try, anti-inflammatories or putting you in a brace to help give you further support. But, if it's really unbearable, options, can include cement augmentations. We call them, you may hear them as kyphoplasty or vertebroplasty, where, you have cement injected in the bone. And sometimes some patients shows, improvement in pain with that. However, there's a lot of studies that shows that if you compare patients who both have the same type of compression fracture and you treat one with no surgery and you treat one with the cement augmentation, that sure, initially the patient with the cement augmentation may have some improvement, but down the line, everyone kind of feels better over time.
Great, thank you. Next question. I have level 1, 25% spondylolisthesis, along with stenosis, scoliosis, degenerative disc disease, arthritis, etc. My question is, are inversion tables recommended? I've read yes and no. Also, should I avoid a chiropractor?
So in terms of inversion table, there's really no substantial evidence whether, it helps or not. I think, some people say it helps, some people doesn't. I mean, if it's not going to correct the spondylolisthesis, it's not going to correct, your stenosis. It kind of hit or miss. Some people get relief, some people don't. And if you want to spend all that money for an inversion table. In terms of chiropractic manipulations, you can try it. There's no contraindication to it. However, you want to make sure that your chiropractor is aware of all these conditions.
Okay, thank you. Next question. Do lumbar spinal fusions inevitably lead to more fusions up the spine because of compensation caused by stiffening in the fused region?
So the answer is yes, that is a risk, and that's something I commonly talk to patients about. The reason why is because when you do a spine fusion, you fuse part of the spine, but the other levels above and below that area are still mobile. And you're still doing activities such as lifting and stuff. So a lot of force and motion goes through those areas that are still mobile. And that causes more wear and tear, and you develop, arthritis in those levels, and we call that adjacent level disease. And if it becomes symptomatic and becomes an issue, and nothing else has worked to help alleviate it, then the next solution may be to extend that fusion higher up.
Great. Again, mentioning the importance of taking calcium and vitamin D. When anyone goes to a drugstore or a health food store, there are inevitably 20 to 30 different brands. Is one brand better than the other?
I mean, I don't think that one brand is better than the other. There's really no studies that compare the different brands, but I do recommend that you discuss it with your primary care doctor to figure out how much you may need or what would be appropriate amount for you to take before you start taking it on your own.
Great. Next question. I hurt myself during yoga 2 weeks ago, and now my low back and hip feel out of alignment. I'm afraid to work out. Can you recommend what I can do to stop the pain?
So I would definitely hold off on any type of physical activity, hold off on the yoga, just kind of rest and avoid any strenuous activity. So I would also recommend working with a physical therapist to help, loosen up some muscles. Sometimes it could be more muscle related. The other thing is, what you're calling hip pain may not be what I'll call hip pain. So, generally, most patients set points to their buttock as their location of their hip pain. And usually a true hip pain is a pain that's right in your groin area. Pain that's around your butt area that travels down your leg, that's usually more of a sciatic pain. Pain that's on the side of your hip over that bony prominence, maybe due to a bursitis. So, it's hard for me to give you exact recommendations without, evaluating you or seeing you in person.
Great. Next question. Can you offer any advice for women who have very large breasts and suffer from back pain and unintentional poor posture as a result?
Right. So that's, that patients with larger breasts can have back pain issue, and then that's well known. I think that sometimes, breast reduction surgery is an option, and, patients have shown improvement in their back pain with breast reduction surgery because it does take the load off your back and also helps with your posture.
Great. Thank you. This question is, we didn't get all of the question, but I'll try to decipher it. What can be done to help if you've been told you have degeneration in your lower back and hip? I am in my 50s.
So degeneration in your back or your hip. So, those are the things that I would, start with initially, anti-inflammatories, physical therapy to work on your core and back strengthening, to strengthen up your muscles, to help strengthen up your back. If you're having nerve pain or muscle pain, you can see pain management or PM&R for possible injections that can help alleviate some of those pain that may be caused by the muscles or the nerves. And then, I would have to see, is surgery an option? That will depend on, other symptoms that you may be having, such as the sciatic pain or the leg pain or stenosis pain that may be contributing to your pain.
Great. Well, this will be the last question, and I apologize to all the questions that we didn't get to. Most of the information that you're looking for through your questions can be found on our website at uhhospitals.org/spine, S-P-I-N-E. Also, too, there is a number if you'd like to reach Dr. Chang for further consultation. It is 216-714-8118. That's 216-714-8118. And again, there will be a follow-up email that is sent in the next 1 to 2 weeks that will have a link to the presentation that Dr. Chang gave this afternoon. So the last question is the importance of a good mattress. What type of mattress do you recommend?
So definitely not an old mattress. So if you haven't changed your mattress within the 7 to 10 years, then that may be time for a new one. In terms of which one is good in particular, it's different for different people. I think that's when you actually have to go into the store and try each mattress to see which one works the best for you. Some people do better with firm mattress, some people do better with softer mattress. So it's not one specific mattress that is good for everyone. But the important part is make sure that your mattress is not worn out and old, where it's not providing you any support anymore.
Great. Well, again, I think we could probably have answered questions for another hour. Obviously, back pain is something that a lot of people deal with. But Dr. Chang, thank you so much for your time today and sharing this information and answering all these questions. And that concludes today's session. Thank everyone for attending. We appreciate you joining us and have a wonderful day.